All right, so this is Lynn. She's a new patient of mine, and we have decided to come to surgery today to fix a problem with her second toe and her big toe on the left foot. So Lynn, can you tell us a little bit about what you've been feeling?
Well, first I noticed the separation in my toes, which really bothered me.
Yeah.
And just kind of all the time having sort of, I wouldn't say pain, but just not comfortable. Not comfortable in my shoes, not comfortable playing sports, the things that I like to do. And I just noticed, and so I thought I should have it looked at.
Yeah, so what we found was Lynn has some ligament instability around the base of her second toe. And so her second toe is kind of drifting over toward the big toe. And if we let that go for a long time, that's going to get worse and worse and worse. Eventually, and maybe some of you have seen this, the second toe will actually lay on top of the first toe, and that's very, very painful. Most of the symptoms are on the bottom of the joint. So what we're going to do today is we're actually going to shorten her second metatarsal and shift it a little bit so that we can get a better position of that second toe. We're going to release all the soft tissues around those joints and make sure that we can reduce all the stress and strain on the joint. We're also going to address her big toe deformity, which is some early arthritis, and we're going to reposition that joint to make it function a little bit. The hardware we put in there is going to stay in permanently and does not need to come out. If it's problematic or is giving you some pain, then we can take it out after everything's healed up. But generally, we leave that hardware in there permanently, which will be a plate and some screws. Okay?
And then my second toe, where you'll take the bone out, you said?
We're just going to shorten and shift. Yeah, so we can do that with just one bone cut. It's an angled bone cut this direction. So we're just going to take that top part and shift it to the side and backwards a little bit. Okay? And that's where the plate goes, right on top of there. We put the plate on so you can walk sooner, so it's more stable, and then you're able to get up and be active a lot sooner before the bone is actually healed, and it will continue to heal despite the fact you're walking on it. Okay. All right, so let's mark your foot.
Well,
next week. Yeah, there you go. So we're gonna put these initials on here. This is permanent, so you never forget who your surgeon was. And so in this situation, we're going to use actually this plate right here. You can see these are by a company called BioPro, and I think they make a great plating system. Go ahead and shoot that X-ray, Jeremy. So we got our plate just a little too proximal. We're going to pull it up this way. Shoot that. Yeah, they're poking through. Stop. Come out. Keep this angle.
Revive.
Yeah.
But they have bit of head, so this kind of...
Yeah, shoot this. No, this actually fits in the hole really nice.
Okay.
So we are just smoothing off all the prominences that we created by making these bone cuts. She should have feel these when it's all done. All right, let's take a final picture of her foot.